Hi everyone, Dr. Emily Harper here. I'm a board-certified endocrinologist with over 25 years of experience practicing right here in Seattle, Washington, at Northwest Regional Hospital. What still shocks me after all these years is how many patients walk into my office with full-blown type 2 diabetes and say, "Doc, this hit me out of nowhere." Then I pull up their chart, and there it is. Their body had been waving red flags for the past 3, 4, sometimes even 5 years. We just weren't paying attention. Today, I'm going to walk you through 9 early warning signs that show up long before your fasting blood sugar creeps above 126 or your A1C hits diabetic levels. And at the end, stick around until about the 13-minute mark. I'll reveal the 10th sign, the one I call the silent killer, because you don't feel it at all, but it's already quietly damaging your blood vessels, heart, kidneys, and eyes. Please watch this all the way through. It could literally change or save your life. A little about me. I've spent a quarter century treating diabetes and prediabetes. When I started in the late 90s, type 2 was mostly a disease of older adults, people in their 60s and 70s. Today, I'm diagnosing it in people in their 30s and 40s, and sometimes even younger. But here's the hopeful part. Unlike many chronic conditions, type 2 diabetes can often be reversed in its early stages, not just managed, but actually sent into remission if we catch it soon enough. So let's get into the signs your body is sending you right now. Sign number 1. Waking up multiple times at night to pee. This is the one that gets missed the most, even by primary care doctors. Suddenly, you're getting up 2, 3, sometimes 4 times a night to use the bathroom. It's not because you drank a big glass of water before bed. This never used to happen, but now it feels normal. Most people blame aging, an enlarged prostate in men, or overactive bladder in women. But what's really going on is your kidneys are working overtime trying to filter out excess glucose from your bloodstream. When blood sugar rises above a certain threshold, your kidneys start dumping that extra sugar into your urine, a process called osmotic diuresis. That pulls extra water with it, filling your bladder fast. This can start happening 1 to 3 years before a standard fasting blood draw shows anything abnormal, because the spikes are mostly happening after meals, when nobody's testing. I remember a patient named John Martinez, a 55-year-old construction foreman from Tacoma. He came in complaining of fatigue. During our chat, he casually mentioned getting up 3 times a night for the past 8 months. I ordered an A1C. It came back 6.1%, right on the edge of prediabetes. His fasting glucose, 98, technically normal. Without that nighttime clue, we would have missed it completely. Sign number 2, constant, unexplained thirst. You find yourself reaching for water all the time, not just after a workout or a spicy meal. This is a deep, nagging dryness in your mouth. Your lips crack, your tongue feels rough, and no matter how much you drink, it doesn't quite satisfy. This happens because your body is losing so much fluid through frequent urination that it's becoming dehydrated on a cellular level. Your brain sends urgent thirst signals to replace the loss. It becomes a vicious cycle. Drink more, pee more, get thirstier. Many of my patients carry a giant reusable water bottle everywhere, car, office, even the movie theater, and think they're being super healthy. But sometimes it's the body's first cry for help. Sarah Thompson, a 48-year-old school administrator, proudly told me she drank over 100 ounces of water a day. Her coworkers teased her about it. When we investigated her chronic migraines, we found post-meal glucose spikes hitting 180 to 200 milligrams per deciliter. She'd been ignoring the thirst signal for nearly 2 years. Sign number 3, crushing fatigue, especially in the afternoon. You're not working harder than usual, but by 2 or 3 p.m., you feel like you could collapse. It's not the satisfying tiredness after a long hike, it's a heavy, brain-foggy exhaustion that makes even simple tasks feel impossible. Here's the paradox. Your blood is loaded with glucose, plenty of potential energy, but your cells are starving. Why? Insulin resistance. Your cells have started ignoring insulin's signal to let glucose in, so all that sugar just floats around in your bloodstream, useless. The fatigue often hits hardest 30 to 90 minutes after a carb-heavy lunch, pasta, sandwiches, fries, soda. That post-lunch crash isn't just food coma, it's your body struggling with a blood sugar roller coaster. Sign number 4, skin changes you can see, dryness, itching, and dark patches. Your skin gets unusually dry and itchy, especially in body folds, under the breasts, groin, armpits, or neck. You might notice velvety, dark patches that look like dirt that won't wash off. That's called acanthosis nigricans, a classic visible marker of insulin resistance. High insulin levels stimulate skin cells to grow faster and produce more pigment. Itching comes from 2 sources: yeast and bacterial overgrowth, sugar feeds them, and damage to tiny nerve endings in the skin. I've had patients spend hundreds of dollars on dermatologist visits, allergy meds, and hypoallergenic laundry detergent when all they needed was a simple blood sugar check. Sign number 5, blurry vision that comes and goes. One day, your vision is crystal clear. The next, it's like looking through a foggy window or someone else's prescription glasses. It lasts a few hours or a day, then clears up on its own. Most people think, "Whew, it went away, no big deal." Big deal. High blood sugar changes the shape of your lens by altering fluid balance in the eye. When sugar drops, vision snaps back. These fluctuations are an early red flag. Diabetes is the leading cause of preventable blindness in working-age Americans. Retinopathy starts silently, no pain, just gradual vessel damage. If you're having vision swings plus any other signs on this list, get checked immediately. Sign 6, declining libido and sexual function, especially in men. Performance isn't what it used to be. It's gradual. Things that worked fine a couple years ago now take more effort or don't work at all. Men often go straight to their urologist or buy supplements online, blaming stress or low testosterone. But high glucose damages the small blood vessels and nerves needed for healthy sexual function. Low cellular energy also tanks libido in both men and women. I treated David Reynolds, a 50-year-old software engineer. He'd been struggling for over a year and was embarrassed to talk about it. Once we uncovered frequent nighttime urination, thirst, and fatigue, his labs showed prediabetes. After 4 months of diet changes and regular walking, his A1C normalized and his function returned without any ED meds. He told me it saved his marriage. Sign 8, tingling, burning, or numbness in hands and feet. You get pins and needles in your fingers or toes, especially at night. Your feet feel strangely hot or cold, and you stick them out from under the covers for relief. Sometimes there's burning pain or loss of sensation. This is early diabetic neuropathy, toxic glucose levels damaging peripheral nerves. It often starts in the longest nerves first, toes and feet. The good news is, at this stage, it's often reversible with blood sugar control. The bad news, if ignored, the damage becomes permanent. Sign 9, recurrent infections, yeast, gum disease, skin, or urinary tract. Women get repeated yeast infections that keep coming back despite treatment. Men battle stubborn athlete's foot or jock itch. Gums bleed easily and infections flare up often. UTIs become frequent. Sugar is food for bacteria and yeast. High levels in blood and tissues let infections take hold more easily, while a weakened immune response struggles to fight them off. I had a patient named Lisa Chen, 52, who suffered chronic yeast infections for years. She'd tried every over-the-counter and prescription treatment. When her gynecologist referred her to me, the full picture emerged: thirst, fatigue, slow-healing cuts. A1C was 6.4%. Once we stabilized her glucose through lifestyle changes, the infections vanished and stayed gone. And now, the 10th sign, the silent killer. The most dangerous warning sign of all is no warning signs at all. That's right. The majority of people with prediabetes and even early type 2 diabetes feel perfectly fine. Their body compensates quietly, while elevated glucose slowly erodes blood vessels throughout the body. Damage builds in the heart, kidneys, eyes, nerves, and brain, all without pain or obvious symptoms. This is why routine screening is so critical, especially if you have risk factors: overweight or obesity, especially around the waist, sedentary lifestyle, family history, age 45 or older, high blood pressure or cholesterol, history of gestational diabetes or PCOS. Don't rely on fasting glucose alone. It misses a lot. Ask for an A1C test. It shows your average blood sugar over the past 2 to 3 months. Below 5.7%, normal. 5.7 to 6.4%, prediabetes. 6.5 and above, diabetes. The best part? Prediabetes is almost always reversible with lifestyle changes. No medications needed for most people. I've watched dozens of patients drop 20 to 50 pounds, normalize their labs, and come off blood pressure and cholesterol meds, all because they acted early. So, if you recognized yourself in even 2 or 3 of these signs, here's what to do next. 1. Don't panic. Knowledge is power. 2. Make an appointment with your primary care doctor or an endocrinologist. Ask specifically for fasting glucose, A1C, and fasting insulin. 3. Start tracking. Keep a simple food and symptom journal. Note what you eat, when you feel tired, thirsty, or have to pee at night. And 4. Begin small changes today, not Monday, not January 1st. Swap soda for water or sparkling water. Choose whole grains over white bread. Take a 15-minute walk after dinner. Small, consistent steps beat dramatic overhauls. And one final thought. If you have kids or grandkids, look at their habits too. Type 2 diabetes is appearing in teenagers and young adults now at alarming rates, something we almost never saw 25 years ago. By improving your own lifestyle, you set a powerful example for the whole family. What keeps me going after all these years is seeing patients transform. They come in exhausted, frustrated, scared, and 6 months later, they're energetic, confident, and healthier than they've been in decades. Your body isn't betraying you. It's trying to protect you by sending these signals. These 9+1 silent signs aren't punishments, they're gifts. A chance to course correct before things get serious. I've seen the same pattern for 25 years. People who listen early live longer, stronger, happier lives. Those who wait often face a much tougher road. You have the power to choose which group you join. If any of this resonated, please get checked soon. It's a small investment of time that could add decades of good health. Drop a comment below. Have you experienced any of these signs? Or have you successfully reversed prediabetes? Your story could help someone else take that first step. If you found this helpful, give it a thumbs up. It helps the algorithm reach more people who need it. Subscribe for more no-nonsense health information straight from clinical experience. Next week, I'll share a practical guide, exactly which foods actually lower blood sugar and which healthy ones secretly raise it, plus sample meal plans you can start tomorrow. Take care of yourselves, listen to your body, and remember, prevention is always easier than treatment. Thanks for watching. See you in the next one.